Hi, this is Dr. Naina. Welcome back to my show, NainaMD, Fusion of Science and Beauty. I'd like to introduce you my next guest, Dr. Raj of Beverly Hills. He's been everywhere, Fox News, you name it. Tell me a little bit about, really, you're an orthopedic surgeon, very well known, and the reason I really wanted the audience to listen and hear you out is because you're doing things that no one else is doing. So, for example, like on knees, everyone is always complaining about, like, oh my God, my knee hurts. I get so many patients that are, I stop running, I can't exercise because my knee injury or my knee hurts. And then I say, okay, what does your doctor have you on? Well, he's got me on medication like Advil or naproxen, you know, some kind of an anti-inflammatory, or they're giving them those Synovisk injections, you know, those kind of injections to help their cartilage a little bit, or they'll undergo surgery. And a lot of times, even after surgery, they're still like limited, or they're saying, I don't get my movement, I can't exercise. And you know me, I'm all about
Absolutely.
Hormones and exercise, diet, lifestyle. I am limited. So I started actually referring to you as some of my patients, and amazing results. I mean, fabulous results. So give us your secret. What are you doing?
Great.
Anti-aging, we need to know.
100%. Number one, the knee is the most important joint in the body. It's the largest joint in the body as well.
Yeah.
The problem with our knees is our whole life revolves around our knees, meaning that if we're trying to lose weight, if we are trying to keep healthy,
Yes.
what do you need to do? You need to ambulate. You need to walk. If you can't walk and you're not active, you're actually out of the game.
Yep.
And once you're out of the game, you'll gain weight, you'll start getting depressed, your metabolic rate will slow down.
Inflammation starts going up, right?
And then you'll start loading those knees. So every extra pound you have is 5 extra pounds for your knee joint. So suddenly you become more and more disabled. So the whole premise of what I do is you look at a knee and how do you not just correct the problem, but how do you turn back time?
Yeah.
And so when I look at a knee, what's different about me is I do joint replacements, I do arthroscopies, and I also do stem cells. So I covered a whole gamut. So you're not going to a surgeon who looks at you and says, I'm going to scope you for the 9th time. You're not looking to a joint replacement guy saying, come back when you're 65 and we'll replace your knee.
So you're doing what anti-aging regenerative medicine is, hey, what can we do to fix a little bit in the inside? What can we start looking at? Maybe we can start having you try to grow your own cartilage, or try to put back a few of the cells that you really need.
That's a great, I mean, it is an amazing concept. Years ago, we couldn't even think about that. Now we've got the opportunity where I'm not taking embryonic cells, I'm not taking amniotic cells. I'm taking your own stem cells.
Isn't that amazing?
So what's better than curing your own body with your own body products? I mean, when we fracture a bone, when we cut our skins, when we rip our tendon, it's our own stem cells that are attracted to the area that repairs it. Suddenly I'm taking your mesenchymal, your own stem cells from your pelvis.
And what's it like, mesenchymal for the audience? Is like the blood, right? That's from the blood, the bloodborne tissues.
From the bone marrow, yes.
Bone marrow, right.
I'm taking these concentrated stem cells and putting it in a knee joint. It's such an attack, your knee would never see it because the knee doesn't have blood supply. So your knee can't attract that number of stem cells. So when I look at a knee, first of all, I look at someone who's aging, who has changes underneath their kneecap, they're limited. We have to look at how to correct this. How do we take them out of pain to keep them in the game? That's why I utilize yourself too. On the anti-aging aspect, you help me get rid of their weight. You help them, physiologically get rid of their depression, their secondary issues.
And also reduce their inflammation so that the stem cells then can thrive. Stem cells will thrive in an environment
100%.
when they're like less inflammation, when you've got the proper nutrition, proper hormone, right? That's like optimum. Then they're happy.
100%. Now here's the deal. I mean, if you have a defect, cartilage defect, meaning no cartilage.
Right.
Traditionally, you'd go to a surgeon. He said, "Let me replace it. Let me inject
total knee replacement,
Synovisk." It's all BS because you're just putting a Band-Aid on what's already there. I'm looking at how do we reconstruct cartilage. So if I go in, what I'll do is I'll do a microfracture technique, scope it, create blood supply at that lesion, then take the stem cells, place them in, and create pseudo cartilage after a while. The results have been incredible. I mean,
And you know, again, explain to the audience that this is, when they hear the word stem cells, it's like suddenly people get scared. We really need to explain to them the concept of their own stem cells, and then also explain what, you know, how the FDA has this thing that you've got to use the tissue and how you have to process it.
Sure.
Just explain that concept so that they feel safe, that this is a real deal here. I mean, you can absolutely do this, and within the FDA guidelines, and it's all okay, because so much misunderstanding and misperception is that, oh my gosh, stay away from stem cells, or, you know, you're going against what the FDA is ruling, or whatever. And please clarify that for us.
Huge stigma, humongous stigma throughout the years, because years ago with the prior government administration, we put a ban on stem cells because of the lobbyists, because everyone envisioned embryonic stem cells. Everyone thought this is sacrificing babies, abortions that led to stem cells.
Yeah.
When you're actually talking about your own stem cells, I mean, I'm taking your own stem cells.
That's
We are
more
not.
natural. That's bioidentical.
Yeah,
Bioidentical.
100%.
Yeah.
You can't get any more natural than this. We're not putting foreign body. We're putting your own products back.
And you're
into
giving it in the same procedure, within the same few hours, or within the hour, you know, as you get it.
Actually, even better, within the hour, because
Yes,
this is
yeah.
all it takes. It takes 45 minutes.
Is that how long your procedure takes?
45 minutes. That's it.
Yeah.
I need 45 minutes of your time to give you back your life and regenerate your knee.
Yeah.
I mean,
Give me, I know we can't name some of our clients, but I know you've had a lot of celebs. Give me a case, just an example, just so that you can share with the audience.
so I had a top A-list celebrity
Yeah.
who was just limping,
Yeah.
a lot of pain. He was suffering. Every time he'd come on set, he'd need Synvis, cortisone injections. He had
gosh.
more cortisone injections. I know what you feel about cortisone.
You know, okay, so let's discuss
Yeah.
cortisone just a bit before you get back. You can, if you continue to have that cortisone, there is a little bit of a systemic absorption, and it can cause a lot of issues. We have seen and taken ultrasounds where it does interfere with bone remodeling,
Oh,
and you know that. And so I think that is so important to say. Where, like, so that is not just the answer, is to give cortisone injections. So anyway, go on. I know I interrupted you, but
I mean, it's
so
a great
important about
concept.
it. Yeah.
It's the best. It's a Band-Aid.
Yeah.
All I'm doing is giving you a month.
So this guy was like having cortisone injections repeatedly.
Cortisone actually on a local level will actually over time degenerate cartilage.
Yeah.
So you'll cause an adverse effect to it. So he's been repeatedly getting cortisone. So suddenly came to me, he got an MRI,
Yeah.
and young guy, he was in his 50s. I mean, 50s is what, the new
that's-
20s?
Yeah,
New
with
fo-
the new 20s, it is.
So what I did is I identified a lesion in his knee, just a bone-on-bone area. He had a bowed leg, so he had increased pressure in that area. So we offered him an operation. He sufficed. He was in good shape. He was just suffering. He was on more Vicodin and
See,
injections.
that's going to mess up the liver, right? So now you take pain meds, which is messing up the liver, causing more inflammation, right? And more accelerating the process to degenerate.
And he was depressed too.
Yeah.
I mean, who wouldn't be depressed if you rely every day? You rely on every step you make. You have to rely on taking Vicodin, and you have to wait for a cortisone injection. I mean, he can't go dancing. He can't go running. He can't just go hiking. His life relied on that. Now he's in a public eye as well, so he had to walk normally on the red carpets. So I took him in, scoped him, did what's called a microfracture. So if he had a hole, I took a pick and stimulated blood supply in that defect.
Oh, so that's going to get the stem cells coming into that.
2 levels, yeah.
Two
You
levels,
get
yeah.
blood supply
And the growth factors, right?
and the growth factors. And then I took his own stem cells from his iliac crest right here.
Which is the bone. So they go. Is it very? It's not painful nowadays, right?
Yeah, it doesn't hurt me at all.
Yeah.
I'm just kidding. No, it's not painful.
It's not painful.
It's
I
done
know
under
now-
a lot of local.
Yeah. Yeah.
I think honestly, like if you have an orthopedic surgeon, this is the second thing is if you have an orthopedic surgeon doing this procedure, that's the person who should do it. We know how to
Yes.
take bone marrow.
Yeah.
We know we can identify the problem. Going to
You know, I'm being honest with you. I do autologous stem cells, which I'll give IV, but
Yeah.
I don't use. I do it intravenously
Yes.
for rejuvenation
And
and all that, but I'm not doing it for the knees. That's reserved, I think, to orthopedics. You guys know that anatomy the best. You can identify because you can fix one or two other things, and you know,
Tweak it,
yeah,
yes.
you tweak it. You tweak it.
We can actually change the fate.
Yeah.
I mean, if I didn't do that, what would happen is then we'd have a void defect. So it's all
Yeah.
about optimizing the effect.
Yeah.
And
So I
that's,
keep interrupting you. So tell me what happened to the patient now. So he comes to you. You did the micro fracture technique. Yeah.
and at the same time did the stem cells. So within 45 minutes, his surgery was done. Afterwards, he walked out. Strong anti-inflammatory, you know yourself, that's the best quality, immediate anti-inflammatory. But what was the best part is that anti-inflammatory effect started day one.
Yeah.
This is not Marcaine or lidocaine, lasts for 2 hours or 4
Right.
hours. Started day one and persisted onwards, and is still there 4 months,
And his life
6
probably
months,
changed, right?
and a year afterwards.
And his life's changed.
We repeated an MRI at 6 months. That defect that was seen
Yeah, yeah.
is not there.
That's regenerative medicine.
Yes.
That's
so
regenerative medicine. And
regenerated is
and
neat.
this is the whole purpose of this show, is to say, you guys, it's the real deal here. Anti-aging, regenerative medicine is here.
Oh,
And
yeah.
we have every means, and we have every viable means to address it.
I mean, and what's the point
Did it
of
change his quality of life? I'm sure, right?
100%. Now we can go out, walk, not rely on cortisone injections.
Yeah.
What's the point of living to 100 if you're living in pain and
Quality,
suffering every
yes,
day?
Yeah. And what do you think about people who always say, like, you know, I'm just getting older. It's just natural to keep aging. How do you? I know how I deal with it. How do you deal with that?
I think it's
How do you
based on
introduce that
society.
concept? Yeah.
It's based on society, and it's people giving up.
Because you know the Genome Project,
Yeah.
the guy says we can live to be 120. It's not any more arguable. It's a fact.
Right.
So why should we not try to have the quality of life and have the sort of, to speak, the 70s or the 80s be the new 50s, right?
What's the use of being stuck in a wheelchair at 70
Exactly.
until you're 120? There's no
Because
use.
because we didn't
Can't
address
function.
the imbalances, right? Because if we continue to address the imbalances, hormones, growth factors, nutrients, stem cells, we can do it.
It's a multi-specialty approach. I'm here, I can fix it, I know what I can do, and then I'll do it 100% over and over again.
Yeah.
But I need you then to take that person and correct their imbalances, correct their hormones.
So the stem cells can stay. Did you know that 2020, I came across it, I'm going to send you this by email. The government issued a 25-page white paper on, the name of the paper is called 2020 Vision for Regenerative Medicine. And they already have planned that there's going to be stem cells treatment centers. There's a lot of references. I want to share.
Amazing.
I'm going to share that with you. I just came across it about a week ago. I was shocked.
And you know,
no one knows
you
it.
and I know what's happening.
Yeah.
I mean, right now, people are out there, even colleagues of ours saying,
Yep.
well, if you do this, you're going to get in trouble.
No, not if you
They're
follow
all
the proper
thinking
diet, yeah.
backwards.
Yep.
And you have to follow the proper protocol. That's why I only
That's
work with winners such as yourself.
And believe me, that's feelings mutual, absolutely mutual. Listen, how did they get in touch with you? How does my audience get in touch with you? Where you're in Beverly Hills?
Simple. My name's Dr. Raj.
Yeah.
I'm not the nose doctor, but I'm the orthopedic doctor.
Yeah, what's the
And
website name?
My website is drhipandnee.com.
That's
So it's drhipandnee.com.
That makes sense. And because you treat the hips too, right? The same way.
I
pretty
do,
much, with stem
yeah.
cells and combination. Yeah.
Absolutely. I specialize in the knee, on the regenerative sports, every different level, but
Thank you so much. Really, it's a pleasure. I'm going to have you on again. So you're already committed. Okay,
gosh,
so
I'd love to. It's my pleasure.
No, it's
is
fabulous. Really, it's been really good, and I think it's just the awareness. And we're going to have something, an amazing topic for the audience next time. Thank you so much for tuning in. And this is NainaMD, Fusion of Science and Beauty. We'll see you next week.